absolute pleasure to introduce Professors Chris Pascal and Professor Tony Bertram from the Centre for Research in Early Childhood. Both Chris and Tony are known nationally and internationally for their extensive work in early childhood and education. Their great passion and interest is a rigorous and systematic professional inquiry, which has meaning and relevance for practitioners. And as someone who's had the privilege of working with Chris and Tony on this project that Chris is about to present, I can absolutely categorically say that's exactly what they do. They do academic research that has, with such respect with practitioners, that is really meaningful and actually pleasurable to the practitioners. And then without further ado, I will hand over to Professor Chris Pascal.
Well, good morning, everyone. And well, if it is morning with you, I know there's a real global audience here today. So whatever time of day it is, hello from me here in south of Birmingham in England. And I'm going to share this presentation with my colleague, Tony Bertram. Do you want to say hello, Tony?
Morning, everyone, and welcome. Thanks for joining us and giving up your Saturday.
Yeah. I'm going to share my screen, and I'm hoping the technology is going to work to enable me to do this. 1 second. Okay, I'm hoping that that's Tony. Can you just?
Yeah, it's good.
That's there. Okay, thank you. So I want to begin by saying hello to this big audience out there. It's really weird to talk to a wide group out there, but a great privilege, and I've been very excited about this conference today. I should start by saying Tony and I and our colleagues at CREC are really grateful to the Froebel Trust, not only for hosting this wonderful day, but they funded the project that Sally introduced just, that the work we've been doing, and allowed us to work in this collaborative way with colleagues internationally on this project. I'm going to talk to you about, we've called this project Young Voices on COVID, and I'm going to start by saying why we felt we needed to do this project, what was the rationale for it, what we actually did, but to spend most of the talk giving you some insights from what the young children have said about their COVID experiences, and then from the practitioners to share with you some of their pedagogic practice around storytelling. The project has lots more evidence. We've got wonderful narratives from parents and families. We've got wonderful multiple stories and narratives from settings and practitioners, and also from children, and all that is going to be available on a website. So really today Tony and I can just give you a taste of it, but with the two emphases on children's narratives and practitioners' pedagogy. I should also say that although I'm presenting this project, and Tony's here to help me do that, and my voice is here, I want to just make the point that in my voice are many voices, and I'm here to respectfully represent the voices of the people we've tried to listen well to, and that is our practitioner colleagues, the children, of course, and the families around those children. So in my voice are many voices, and I'm just hoping I can do justice to what they shared with us. Okay, so I'm going to give you some context to this study, which was a very intense project that started in August last year, and came out of our awareness, as Mark said, about the impact of the last year or so on everybody's life. And we know that COVID has brought huge shifts and changes in everybody's daily life. And we're part of this discourse, and we reflect on that from an individual perspective. But we know that children have been caught up with this, and we also know that the project has impacted disproportionately on different sectors of our population. And we were particularly aware that younger children's voices were not being heard, or their experiences weren't being foregrounded. And especially we knew that the impact of the pandemic on vulnerable and less advantaged has been particularly hard. And if anything, the existing inequalities that many of our societies have, and certainly living in England, I know the inequalities that we have in our society, but I think it's a global thing. We know that what the pandemic has done is highlighted and shone a torch on what those inequalities are, the consequences of those inequalities, and actually have deepened them, if anything. You know, and this is what poses a big challenge as we try and emerge from this crisis, the pandemic, is do we take that seriously? And these are big conversations that we all need to have. We've been kind of really dialoguing with those close to young children, the practitioners and the parents, and we know the additional stress, socialization, the dealing with illness, and the consequences of that on children's well-being. And we know that what happens in the home has long-term consequences for children. We also know we've been living through this for over a year now, coming up a year, but in some places over a year. And this is a major part of children's life proportion. And we know that interaction, social connection is really important to children's healthy development. And what they've been dealing with is restrictive contact with other people, and even immediate family. I mean, Tony and I have grandchildren we haven't been able to interact with for a year. It's a huge loss for us. But on those children, it's got huge consequences about how they learn to live interactively within their family units, their wider family units, or going down to their local shops and their local communities, how restrictive that's been on young children. And, you know, that many of them have had restricted access to their friendship groups at nurseries and daycare centres and all of that. So we were very aware that young children, like all citizens, had a severe disruption to their lives. But you know, there are hierarchies, voices that are louder than others, and young children, we felt, were not being foregrounded. Their voices weren't being encouraged to speak, and they certainly weren't being listened to. You know, the hierarchy of power often puts children, you know, fairly low down in that. And we wanted to change that. We wanted a project that really flipped that and changed that round. And that comes from a deep commitment that we have at CREC, and the Froebel whole philosophy really celebrates children's right to a voice. And we know that there's the UN Convention, which says that all children have the right to speak and to be listened to and to be able to shape decisions. There's a lot of rhetoric around that and a lot of good intentions, but often the right is not realised. And yet those of us who work with young children know how capable they are of reflecting on their experiences, of expressing their opinions. They're very competent performers, competent consumers of life, competent actors. And they've got a lot of agency. And we live in societies that say they are citizens from the moment they are, and that we should give them the sense of their citizenship. And at a time where across the world, we're all looking at what does democracy mean in the modern world, and some of us in what we would hope to be very democratic societies have seen how threatened that can be very quickly. And encouraging children to realise their citizenship and their voices and how to make that have a reality is something I think that early childhood settings should be really actively promoting. And so, you know, these children's right to have a voice, and us to respond to that should be really important. And so the project was really about finding ways to really encourage children to express their voices, to express their experiences, to express their desires and wishes about how they were going to live their lives during this time, and how we as practice focused individuals can kind of support and extend that. And so the project was born. We began last summer, and working with the Froebel Trust, we had 3 very clear aims. And the first and foremost was to help children and support children to realise their voices through their narratives and their narratives about their experience of the COVID pandemic. We wanted to listen to children very well and give them every opportunity to express what their experience has been, so that we could respond to that. And we also agreed that we were going to use the power of storytelling within a Froebelian pedagogy. And particularly we felt that that would promote children's social and emotional health and help them through the expressiveness of their narratives to contain and manage and deal with the stress and fears and anxieties that had come with this extraordinary time that we were all living through. And finally, we wanted in our practice to promote the view that children are active, thinking human beings who make connections, and we need to value them a little bit better and to live that out in a more authentic way in our practice. Our work is always to be collaborative, and I know there are many people that have worked with us on this project, on this conference today. So I hope they'll see themselves as I speak. So it's praxeological. This is an approach to practice which really takes values and ethics to its heart. It's a form of action research. We work collaboratively together to transform practice, to find out about practice and transform it. We agreed to work in 4 different Froebelian nursery settings, who were all set in less advantaged communities and in 3 different countries. So trying to get that broad view. And we worked in 3 countries where the pandemic has impacted, but has had a unique course. Every country is experiencing this, but experiencing it differentially. So there was 1 multi-site nursery in England, 2 sites in Scotland, and 1 site in New Zealand. And you can see England probably has been impacted most fully and dangerously by COVID, and in our project New Zealand the least. They've got it, but they're managing it differently, and I would say better. In total, we gathered detailed narrative sequences over a 4-month period from 58 children and worked with 22 practitioners. So that's where the data and the evidence has come from. So I want to say a little bit about the Froebelian storytelling approach, and I have to say I'm very indebted to Tina Bruce and Lynn McNair and Jane Winnett, who really have helped us understand how storytelling works. And it's very embedded in Froebel principles and pedagogy. And, you know, historically, the Froebel philosophy foregrounds storytelling in play, music and dance. It's not just oral storytelling. Children's narratives come out in many, many different ways and are expressed in many different ways. And it's very much seen as an ability for children to express their inner world in an externalized way, which is good for their social and emotional well-being. So we trained all of our 58 practitioners. They had a CPD day on storytelling and ways of developing storytelling in practice. And the idea was that they would work with us to offer as many opportunities as they could to encourage children to express these inner world insights. And I'll talk a little bit more about that a little later, but they developed and experimented with their practice to provide lots and lots of affordances or opportunities. And then we captured the way the children navigated that and the stories that came out of that. And the stories could take many forms: role play, songs, dancing models, drawing conversations, and it could emerge at any time in the day. It wasn't like, well, this is a play event. It was as they lived their daily life, opportunities were there, and the practitioners were going to do their best to capture, to listen, to observe, and to capture what was going on. So very much child-led and child-leading what they were. And the narratives were complex, and some of them were extended, some of them were one-off, some of them were very simple and direct, some of them were quite embedded and complicated and easy, and that's been the real learning, and the joy of it has been puzzling. What are these children saying to us? How do we interpret what's coming out, and be really open to the way they express that and the way their narratives were expressed. How it basically worked is that we had a group of practitioners in each of those 4 study sites. We had CPD having a training day on storytelling pedagogy. Tony and I, led by colleagues, and Tony and I led the action research and documentation CPD, and each site, so the 4 sites, had somebody who was on site that was a pedagogic lead, and somebody who was a research lead from CREC, my own organisation. The idea was that from their children, a range of children aged 2 to 4 years in each site was selected as case studies, and over a period of 3 or 4 months, practitioners would work with us to document, and then we're calling it curating, put those narratives together into a set of sequences for each child, which were clearly going to be multimedia and expressed in many different ways. Alongside that, the practitioners agreed that they would document in a log and a journal, and through their conversations, we had regular conversations and team-based conversations which were documented, where we explored the pedagogic strategies they were using, and they documented those. And then across that data, what we did was look at themes and saliences across the 3 countries to bring out the practice and policy implications. Lots and lots of shared learning, and the very interesting differences between the New Zealand and the Scottish and the English contexts. And that's been fascinating as well. What did we share, and what was culturally quite different. So I'm now going to move on to what came out of that. Clearly, a short, clear project over a time limited period, but we have learnt an enormous amount from those that have been involved with it, and the children in particular, I think, have led us and learned. And we often in our conversations said, you know, the children are showing us the way. The children are dealing this sometimes better than we as adults are. Let's just look at their wisdom and look at their ways of dealing with it. It was clear that through their narratives, through their storytelling, through their play, which is the vehicle through which the stories were emerging, that it was helping the children to tell their experience, to explore how they felt about it, and what they wanted to do about it, and to give them that sense of connectivity. And 4 key strands is the children's wisdom, how much we should trust them more, I think, to have agency and to look at how they deal with things, that they're quite robust and resilient, and have been through this period, navigating their own way through it, and understanding their own and others' needs at this time. This companionship and this way they've supported each other and self during this time is really been interesting and informative, and, you know, lessons to learn from those. So for the children, I particularly want to talk about the insights from them. We've divided those into kind of 4 strands here, and I'm just giving you a taste of what's there. And I've linked these to Froebel principles. So the first strand was about transitions and reconnection. In all 3 countries, we had settings that were open and then closed, or partly open and closed. Children who are having to go to new places or not go to places and then go to places. So during this period, children had experienced a lot of transitions, and transitions of what routines that had changed, so to transit to new routines and then reconnect. and how they navigated that was really, really important. But what major strand is how that sense of belonging and community and friendship and relationships, how deeply important that was, and how skillful they were at re-engaging and reconnecting again. And you'll find in our report Oliver's story, who used song and music was a really important. A lot of the settings had Zoom or Teams or Skype contacts with children, and they often began with a connecting song or a gathering song and singing, and the children making up songs was really, really quite important in what we found out. But you saw the children, the practitioner leading the songs, and then as it went on, the children would use those same songs to reconnect with the children, and particularly the ones that they wanted to. So transitions and reconnections and supporting those is really, really, really important in our work. The second insight is that children, through their stories, they expressed, and through their narratives, expressed a lot of resilience and a lot of intelligent strategies of dealing with their experiences. But some of the children, and we needed to acknowledge this, the way they dealt with that when they came to nursery was to not talk about it, actually, to explore their normal day life. Some of them, it was like, well, that's going on, but I want something different. So they would engage in their normal superhero play or other imaginative play or block play or whatever, and just get on with that. Some of the children chose to deal with it through moving into other things, and certainly in New Zealand, who have moved almost the other side of the pandemic, they're out the other side. It's like, well, that was yesterday, we've moved on, and we should respect their right to do that, to move on or to have space outside of it. But for most of them, they did want to express what they did. And one story is Kaylee, is she'd missed she was supposed to have a graduation to the bigger school, and she'd missed that. And she just kind of dealt with it and said that, you know, quite stoically, well, I've not missed it, it's just put off, it's just delayed, I'm going to have it. And developed a wonderful way of, she couldn't kiss or hug people, but she developed this way of hugging herself as a signal that she was giving you a hug, and doing this with a hand, which was a kiss. So really finding ways to connect, to reconnect, and alternatives. And it's not a big deal, we're just going to find a way around this, and showing us to just get on with it. The children, as I say, taught us about resilience and getting on with it and finding different ways of doing what you always do. The third strand is the importance of outdoors. And of course, this is a key Froebelian principle, that engagement within nature. And lots and lots in our study, which has shown for the adults as well as the children, how significant the outdoors has been, not just because it's ventilated and it's safety, although for the practitioners, they often felt more secure outside. But actually what it's done is reinforce again the deep significance of outdoors to children and adults' well-being, and that engagement with nature. And you know, there's a story of Adele who the nursery had got access to a kind of wild area, and this was in the autumn when the blackberries were there, and just watching her in a deep way gathering blackberries. She'd been, during the pandemic, she'd early on, she'd been with her grandma and done this, and then come back, and she showed the other children how to gather the blackberries and put them in a pot and then have them for their snack. But that kind of deep connectivity to the seasons and that awareness of the seasons, and the children, we found that the children, given the choice, because all the nurseries had free flow between indoors and outdoors, the children were far more often choosing to be in the outdoors than the indoors. You know, it went up disproportionately most of their day, and with free choice, they were choosing that was outside. And so the practitioners are saying they're going to flip their provision to say that they start every day outside, and the outside is where they're locating themselves now. Indoors is an option rather than outdoors being an option. So that engagement with nature and the deep, it's almost a spiritual thing as well as a sensory thing, that in a Wordsworthian romantic nature, that the natural world has become, I think, more important to all of us, but children get it and they're naturally drawn to it. Fourth is that the staff, and we saw that the actual way children were playing was deeper and different and more prolonged in some cases. And also interestingly, they noticed it was done with smaller groups, and also quite often with children on their own. And whether that's because being at home more, they were used to playing on their own, having to play on their own a bit more, or with smaller groups, but they were tending to work individually or in smaller groups and go for prolonged and repeated play. And through that play, they were exploring some quite deep things. And one of these prolonged games, repeated games, was something the children called the death game. And clearly they'd seen and experienced COVID death, and they wanted to explore that. But the interesting thing, so they had this game where the mum started to cough, and then she lied down and the children tended to him, and then the mother died. This was something they wanted to reenact, but they wanted to do that, this small group of children, away from the adults. And if the adult came near, they stopped the play and moved on, and then reconvened it at another time. And we're reflecting deeply on that. Was it because they thought we felt as adults that wasn't appropriate, or was it just a private thing they wanted to explore amongst themselves? Quite interesting how they, what they want to explore and how they explore it, but giving them the opportunity to have some privacy in that was something we've talked quite a lot about. And then the final bit that's come out is how much children are curious and about what is going on, and understand and get that understanding. Remember, these are very young children, some of them 2 and 3, and they really were curious about the virus and its construction and what it looked like, and understood about infection control and spitting and the masks and why we've got to socially distance. They didn't need to be protected from all of that. What they needed to have is knowledge, and authentic knowledge, and we're almost in a kind of scientific way exploring that again in their play, but also through their drawing and through their creativity, wanting to look at that visual system of the visualization of what the virus looked like and how it was transmitted. They really are young scientists. Okay, so from that and from all that evidence, we want to disseminate and are actively, and today's part of that. How does policy and practice deal with that information? How are we getting information for children? Well, what we know is that they want to get their daily life and routines back. They're desperate to get back with their friends, to get back to visiting their family, to get back to being at nursery and have their lives back. Like all of us, they're just as strongly motivated to do that. They really do want extended time to play, and this catch-up discourse that's out there. We have to counter some of that. Is the best catch-up is to give them time to immerse themselves and play and explore where they are and what they're dealing with, and through that they're learning all kinds of things. But play is so centrally important, and they've missed a lot of that. A lot of these children, they need to be outdoors, and we need to really open up and extend our outdoor provision, and we need to give the children authentic information about the virus, about its control, and treat them in a civic way as a citizen that have the right to have that information and make their own decisions about that. Okay, I'm really conscious of time. The practitioners themselves have been brilliant at documenting their different storytelling techniques and how to explore that. And there's just a taste of them here. Deep conversations, giving children time for sustained shared conversations that go on over days and are reiterated, one-on-one, small group, giving the children time to talk and be with each other and just be together. And those conversations are not just talking conversations, they're bodily conversations and creative conversations. You can see a picture of a screen, of a wooden box that was set up in one nursery as a TV screen, where the children came and reported each day and were filmed like a news reporter. What's your news? What do you want to share? Lots and lots of role play. You'll see the home quarter area. I don't know if you can see it, but one child took the computer from the computer area into the home corner and started to role play her parent working from home. Just very, and that flexibility of the children creating their own scenarios, singing and music making, puppets, craft work, modeling, lots and lots of different techniques which the practitioners would be doing. None of this is totally innovative and new, but deepening it and extending it in the practice is what we've seen happening. So legacy learning, the one big thing is how coming together, the parent, child and practitioner with support from us at CREC, I hoped that we added to it, but really working together to listen and document and then reflect and then to act to transform practice. It's the most brilliant tool for keeping ourselves ahead of what's happening, keeping ourselves moving our practice on. And we don't want to go back. We don't want to go back to where we were before. None of us on this project. We want to use this deeply difficult and challenging experience to move forward and think together forward. How do we do things better? What have we learned from this? And the major thing we've learned is the deep value of play and storytelling, not just for children's development, but also for their well-being. We've learned that we need to slow things down a bit. One of the joys at home, interestingly, and at the nursery, the parents are saying it and the practitioners are saying, we've been able to slow things down, listen more to children, listen more to parents and each other, and dialogue together. Somehow it's given us this bubble of space and time. And I know Alison Clark this afternoon is going to talk about slow pedagogy, but we've really seen the benefits of that. We've seen the benefits of starting sessions outside and then opening up the inside and bringing the outside to the inside rather than the inside to the outside. So flipping that round. There's a whole lot of stuff we've learned about working collegially and respectfully with our parents to strengthen that relationship, and how social media's helped with that. But actually on both sides, we've highlighted the real value of that home visiting and that face-to-face time, but shifting and changing those relationships. That I think on both sides, parents and practitioners become more deeply respectful of each other. And we want to take that bit of learning forward too. So to finish, the power and challenge of children's COVID storytelling, and this lovely quote by Froebel: the telling of stories refreshes the mind as a bath refreshes the body. It gives exercise to the intellect and powers, and it tests the judgment and feelings. This work we've done collegially over the last 6 to 8 months or so has done all that. I think it's given us hope during this time. We were very nervous about asking practitioners to do this additional extra at this time, but I think what they've said to us is it's been what's kept us going. It's given us something really positive in this difficult time. It's helped us really be alongside and closer to the children and their families. And it's made us think harder about what we do. And moving forward, the test will be our judgment of what we do with all of this. So the challenge for all of us is to respond authentically to what our children, and I'm going to add parents, are saying. And I think we will be judged with how well we use this experience to learn and to build back different and better and more fairly for the future. Thank you very much. And